Okay, so similar to the two previous presentations, this is also largely based on the second policy brief, which is part of the JMRIG policy brief series on COVID-19. So the members are actually coming from different sectors. So we have some researchers like me, so people from the academe, and then some health professionals, as well as local governance practitioners. Okay, let me start with how we are framing COVID-19. Chris already mentioned that, this is a complex emergency. But more than that, we are looking at COVID-19 as really a fundamental or multidimensional crisis that has affected many facets of our local and national, even international and global politics. So we have witnessed the dismal conditions of our public health systems coupled with a not so coherent strategy. And then, of course, we have seen how livelihoods of many Filipinos have been decimated because of the economic meltdown. And then the crisis, to a certain extent, has also revealed the imperatives for responsive and evidence-based leadership. So over the last few months, we have witnessed the fragile healthcare system in the Philippines, and in a way, a not so coherent national response. I think Ador and Dr. Yos also mentioned these issues, how the limits and then even capacity of local governments in many areas in the country have also been a prominent issue as we try to deal with the crisis. Some well-resourced LGUs are better able to, respond to the needs of their communities, but others have been struggling until now to even prepare their local system to manage the onslaught, the impacts of this pandemic. So given this multidimensional nature of the COVID-19 crisis, our team has identified health systems governance as really the overarching framework, the guiding system that could help us identify key needs and corresponding steps that would hopefully help us recover from this crisis. So there are different principles, but I won't be touching on each of them. I would just be emphasizing three key components of health systems governance. So one is the importance of identifying a clear and viable vision within the locality. The question is, how are we going to recover from this crisis? What needs should be prioritized? And this vision should also be able to respond to health dimensions as well as socioeconomic and institutional aspects of this crisis. Later on, in the next few slides, I would be elaborating on some of those key dimensions. Second, a clear vision requires inclusive and equitable process that reaches out to various social sectors, particularly the most vulnerable groups. Those sectors that are often hidden from the gaze of the state, normally invisible from our official government statistics. And then third, LGUs need to assess their institutional capacity, our ability or inability to respond to certain aspects of the crisis, and determine what needs to be strengthened and how certain governance arrangements, particularly local and regional governance arrangements, can be put in place to achieve certain identified goals, short-term and medium-term goals. And let me be more specific. So here are certain elements that LGU should consider in revisiting and refining their local systems. One, there should really be a clear time frame. So in our policy brief, we in a way frame the phases into three: immediate, addressing or responding to urgent needs; then transitory, trying to identify the not so urgent yet still vital needs in the community; and then medium term, which is basically about planning for recovery, coming up with steps that would hopefully help us transition into a better normal. A second important element is really a sustained attention to addressing the diverse and evolving needs in our localities. So while the crisis has affected everyone, there are uneven impacts. Some poor people would be more heavily affected by this crisis than, the middle class or the high income class residents in our community. So we need to be very attentive to diverse and evolving needs of our constituents because some might be needing or requiring more assistance than others. Then, of course, the process also requires multi-stakeholder collaboration. So there should be synergies between national and local government intervention. So we have the IATF at the national level. It's important that we also have that system at the local level. But that system, that local system, needs to harmonize its initiatives with those happening on the national or regional level. Okay? And then, of course, multi-stakeholder collaboration also entails partnering up with civil society groups and the private sector. So we have NGOs, community-based organizations that might have the resources that could complement what the LGUs could offer. So it's also very important to identify these organizations, determine what they can offer, and identify possible institutional arrangements, partnership agreements that would get them on board, that would get them, for them to be part of the process. And then finally, and I would have probably a brief discussion of an emerging framework, planning framework. It's always important to identify what specific planning model we are following or we are basing our steps on, because otherwise it's always difficult to just identify key steps without that overarching planning framework. Okay, let me now go to the immediate needs that LGU should be able to respond to. So this is just probably a recap because we've been seeing these steps on national television. So we're framing this into two measures. One aims to prevent the spread of the virus and protect the citizens from getting infected. So the usual steps, the hygienic practice, hand washing, the wearing of masks, physical distancing, particularly in public places, and then of course, the regular and frequent disinfection and proper sanitation of our, well, mostly public spaces in our localities. The second set of measures has to do with, it seeks to control and contain the virus. So if your locality has registered confirmed cases of COVID-19, then these are the steps that we should be able to undertake. So it involves, a clear system wherein LGU should be able to come up with a case management steps. Then you have health resource mobilization as well. And then a system for disposal of infectious waste, and then we have the people dying of COVID. So there's also that important system how we can bury them alongside trying to maintain peace and order in our locality, because a crisis can really inflict some level of shock on some residents in the area. Now, with respect to transitory needs and challenges, there are two crucial aspects here. One is really the maintenance, keeping the flow of essential goods, personnel, and services unimpeded, and trying to address possible disruptions in the non-COVID-19 medical services, because some people might still be needing medical attention to address their other medical needs. And then, of course, it's always important to identify specific needs of our health frontliners and other essential workers. For instance, transportation is a very basic but also essential need of health frontliners. Are we able to provide that in our locality, especially for some essential workers, probably not health frontliners, but our farmers and members of economic activities in our area. We've also heard reports about ECQ pass implementation and some confusion. So I think it's always important to clarify the system in our area to avoid confusion and also facilitate the smooth functioning of economic activities in the area. To keep the economic activities flowing, even as we deal with the crisis. The other aspect of transitory needs, again, has to do with trying to monitor the situation of the most vulnerable sectors. So here we might be talking about the elderly health-wise because they are probably among the most vulnerable, especially those with pre-existing health conditions. But socioeconomic wise, we might also be dealing with the poorest families in our communities. So here it's important to have a complete and updated set of database of our poorest households. This is crucial when we try to distribute aid, whether if it could be financial assistance or some relief packs, whether this assistance is coming from national or local governments. It's always important to identify the poorest households and ensure that the relief goods or cash assistance is really reaching those who are targeted by the system. And then I already mentioned the importance of recognizing and supporting solidarity-based initiatives. In different LGUs, we've seen how development NGOs, civil society groups, and even private sector organizations have provided the much needed assistance to some low-income communities. So it's important to recognize that, but also try to strengthen the system that would facilitate instead of undermine these non-state initiatives. So in some areas, they have conducted community kitchens. So it's always important to identify institutional arrangements that would encourage and enhance this kind of non-state initiatives in our locality, because they have the resources and the human capacity to conduct these activities. Of course, as I said, medium-term recovery or medium-term needs and challenges also entail thinking about economic recovery and job generation. So in many areas, a lot of economic activities has stopped, and we need to somehow transition into irregular economic activities. So as we transition, we need to also identify the livelihoods that have protected these workers. And in many communities, especially in many cities in the Philippines, workers are employed in the informal economy, and their economic activities are usually built on self-help practices. The sari-sari store system, home-based trading, street vending, pedicab driving. These are everyday economic activities that are often, disregarded or not recorded in our official statistics, but they are essential for the poorest of the poor in our community. So when we try to come up with economic recovery plan, it's always important to look into these ordinary activities. And then co-financing. In The National Recovery Plan, probably some of you have reviewed We Recover as one document by the national government. One aspect of that is talking about co-financing. And in the document, it's also emphasizing how local government should be playing a greater responsibility in service delivery. So at this point, local government officials should be exploring possible sources of funding, whether it's through aid or partnership with the private sector and other government agencies. It's time that we try to identify possible sources of income or sources of support for our planned economic recovery. And then in the National Recovery Plan, there's also a discussion on, and this is very important for cities and urbanizing areas which have been heavily affected by COVID-19. The plan is also talking about the importance of providing ample green and open spaces for socialized housing, and even public space that could be used for quarantine isolation areas. In some of my fieldwork activities across different cities in the Philippines, one observation is that we don't put so much value on public space and open space. And then, of course, this is very important, not only for creating a vital public space life or street life, but we have witnessed its importance now that we're dealing with a crisis. So when we try to, revisit our comprehensive land use plan for long-term plan and for comprehensive development plans for a more short-term period, it's important to think our strategies and possibly try to integrate these concerns into our development planning agenda. The importance of open spaces, especially in highly dense communities. And then, of course, the provision of public spaces in our city centers. And all these interventions, the estimation of the population growth, the need for spaces and the spatial dimensions of crisis recovery should always be informed by evidence. We've been talking about evidence-based policymaking. This is our opportunity to exercise this important undertaking. Now, my final point is about the importance of planning framework. I already mentioned this in the beginning. A planning framework that will guide our current and future planning governance interventions. So for decades, most of our cities and municipalities have been very fixated on growth chasing model of local development, a planning model that would, in a way, bring us a lot of foreign and local investment. As we try to bounce back from the economic impacts of this crisis, there's always that temptation to go back to that old growth-chasing planning model. Yet, many studies of local and urban development situation in many countries have revealed how this model has failed to significantly reduce urban poverty, local poverty, and has instead reproduced inequality in many cities. So as we transition into a new normal, hopefully a better normal, we need to revisit and refine the usual local development models and planning imaginaries that frame our ways of thinking and in a way influence our policymaking processes. So here I'm inviting LGUs, especially the planners, to adopt a planning of care framework. So this is first discussed by Inji Jan, one of my colleagues here at the University of Melbourne. And she's basically saying that planning framework is a recognition, or planning of care framework is a recognition of the human interdependence and the inherent relationship between cities, municipalities, and their natural environments. So it's important that we have that recognition that cities and localities are interdependent, and we need to care for each other. So it urges planners to shift away from highly individualist and growth-oriented local development framework, and somehow the importance of recognizing that planning outcomes and processes should be able to embrace and respond to our vulnerabilities, the vulnerabilities that have been exposed by COVID-19. But these vulnerabilities are shared by us, by communities, by cities, and by, of course, countries. So in short, this is a framework that invites us to think about how our interdependency and mutual responsibilities with one another should be integrated into our local planning processes. And for me, as a urban governance practitioner and as a scholar, I think this is a path, this is a framework that would, in a way, bring us to a more socially inclusive city and a more, probably a stronger local resilience in our local governments. So I think that's it from me. Thank you.